Hey, can you guess what we're moving on to now? You got it. Zombies. Oh, as it turns out, we're talking about the liver now. When we think about the liver, most people first think of our, quote, poison filter of the body because that's a major function of the liver. However, we need to also remember that it is much more than that and is involved in metabolism of carbs, proteins, and fats. If you recall from what we know about insulin, you might remember that it takes sugars out of the blood and stores them in the liver. Glucose is changed to glycogen to be stored and then turned back into glucose when needed for energy or to make fats. Proteins are also made in the liver from amino acids. Amino acids are also converted to carbohydrates, keto acids, by removing the toxic ammonia and then turning the ammonia into urea before excreting it out as urine. The keto acids are converted to fatty acids for either storage or production of fat, or they can be used directly for energy if needed. Fats can be oxidized for energy, or synthesized in the liver, as mentioned above, and packaged into lipoproteins and sent out into the blood. We usually think about these as cholesterol. The metabolism of drugs and hormones, as we already know, is a very important function of the liver. It can change them into water-soluble forms, detoxify them, or inactivate them, depending on the specific drug or hormone. The liver is also involved in the production of bile, which includes bile salts, cholesterol, bilirubin, electrolytes, and water. We could easily talk about hepatitis all day long because there's so much to the various strains of the virus. As the name implies, hepatitis is an inflammation of the liver. Types A and E are the types that are considered fecal-oral and are the less serious of the group. Unfortunately, they're also fairly common as not everyone has excellent hand-washing skills that might be preparing our food. Hepatitis types B and C, the more serious types of hepatitis, and are both related to transmission through needles exposed to infected blood. Understandably, they're more common in persons who abuse drugs. Type D can only be contracted in persons with active type B, but the combination is more severe than just type B alone. Those with hepatitis will manifest clinical symptoms consistent with a viral infection and with a disease of the liver. How severe the symptoms are will depend on the specific type of hepatitis and if it's just mild or becomes fulminant hepatitis. Hepatitis B and C can cause death if not treated aggressively. In many cases of hepatitis, the patient will manifest jaundice. Erythrocytes, red blood cells, are normally broken down in the spleen and liver at the end of their lifespan. The end products of RBC metabolism are heme and globin. Globin is degraded into amino acids and recycled to make more proteins. The heme portion is converted to biliverdin by removing iron, and biliverdin is converted to bilirubin. Bilirubin binds to albumin and is sent to the liver to be further metabolized. If the liver is not functioning properly, the bilirubin accumulates and causes jaundice. High levels of bilirubin are toxic to the brain. To test for hepatitis, we use specific antigen antibody tests, which is a day's lecture in and of itself to fully explain. Although not specific, elevated ALT or AST liver enzyme levels will show that something is damaging the liver. Non-alcoholic steatohepatitis, Nash, is an idiopathic silent disease that very slowly turns the liver fatty over a period of decades. Since it only affects 1 to 2% of Americans, and over 50% of Americans are overweight, it's unlikely caused by obesity alone. Symptoms include a dull pain in the abdomen and fatigue. When NASH is in more advanced states, jaundice will appear and a biopsy may be needed to rule out cirrhosis of the liver. Ultrasound will show a fatty liver, and of course ALT and AST enzymes will be elevated as shown on the blood test. Cirrhosis of the liver means that there's scarring from fibrosis and results in obstructing the flow of bile and blood through the liver. It can be caused by many different mechanisms, including chronic alcoholism, hepatitis B and C, and Nashs. Signs and symptoms are mostly as expected with any liver disease, including fatigue, nausea and vomiting, edema, jaundice, and hypoglycemia. Additionally, the fibrosis and subsequent blocking of blood flow can cause portal hypertension, which can lead to ascites and esophageal varices. Varices are inflamed veins that could burst, so you can see why they would not be welcome in the esophagus. Likewise, the increased portal hypertension can cause other bleeding problems, including encephalopathy, which we will find out later in the course can be life-threatening. Pruritus is another name for itchy skin. This symptom is related to the blockage of bile. These last two slides are gross specimens of the fibrotic scarring seen in liver cirrhosis. It probably doesn't take too much of an imagination to see why this might cause problems in the blood flow through the liver. This last slide is another good slide that shows a difference between hypo and hyperthyroidism. Like I said, we'll look at hyperthyroidism later as part of anxiety, but it's always nice to compare side by side when possible. And this ends the thyroid, adrenal, and liver fatigue topic.